I still remember the moment it started to bother me, not in a dramatic way, not all at once, but in small, almost unnoticeable signs. A patient sitting in front of me, mid-40s, successful, disciplined, someone who did everything right, brushed every day, used mouthwash, never skipped a dental visit, and yet there it was, the hesitation in their voice when they asked, "Why does it feel like my teeth are changing?" That question stayed with me, not because it was unusual, but because of how often I had heard it before. Different patients, different backgrounds, different levels of income and education, different cities, different lifestyles, different diets, and yet that same hesitation, that same quiet worry, as if they already suspected something was wrong but couldn't quite name it, as if they had been carrying that question for months, maybe years, without knowing exactly how to ask it. And I noticed something else too. The people who asked that question were rarely the ones who had neglected their health. They weren't the patients who avoided the dentist for years, who never brushed, who lived on sugar. No, the ones who asked that question were usually the careful ones, the conscientious ones, the ones who took care of themselves, who invested time and money into their health, who followed the rules, and that, more than anything, is what made the question so haunting. Because if someone who does everything right still ends up asking, "Why does it feel like my teeth are changing?" then something is fundamentally broken in the advice they've been given. And over the years, I began to notice a pattern that most people only recognize when it's already affecting their confidence, their comfort, and sometimes their future. This is where my perspective shifted. You see, after 45, your mouth is no longer the same environment it used to be. The gums respond differently. Saliva production changes. The enamel doesn't recover the same way, and yet most people continue following the exact same habits they've practiced for decades, habits they were told were correct, habits learned in childhood, habits reinforced by commercials, by well-meaning advice, by routines passed down without question. That's where the problem begins. Because some of these trusted oral care routines, the ones repeated over and over, passed down casually, even recommended without second thought, may actually be accelerating the very issues people are trying to avoid. And I've seen the consequences up close. I've sat across from people who were genuinely confused, who felt betrayed almost, because they had done everything they were supposed to do, they followed the instructions, they bought the right products. They showed up to their appointments and still, something was slipping. It starts subtly, a little bleeding when brushing, a slight sensitivity to cold water, maybe persistent bad breath that doesn't go away no matter what you try. Then comes that strange sensation, like your teeth aren't as firm as they used to be. Not loose exactly, but not as strong. And that's when the concern turns into something deeper, something harder to ignore. What most people don't realize is that these are not isolated problems. They are signals. Signals that something in your daily routine is no longer aligned with what your body actually needs at this stage of life. And here's the uncomfortable truth I had to accept as a dentist. Many of these issues are not just about what people are missing. They're about what they're doing consistently, without realizing the long-term impact. I need to pause here and be honest with you, because this isn't something most dental professionals talk about openly. There's a tendency in clinical settings to focus on treatment, to address what's already happening, to fix what's already broken. But there's far less conversation about why these things keep happening in the first place, about the invisible cycle that brings the same patients back year after year, dealing with the same problems, spending the same money, without ever getting to the real root of it. And I believe people deserve better than that. I've had patients who spent thousands trying to fix recurring gum problems, treatments, cleanings, special products, always chasing a solution. But no one ever stopped to question the root cause. No one ever asked, what if the problem isn't just what I'm lacking, but what I'm repeating every single day? That question changed everything for me professionally, because when I started asking it, not just about products or supplements, but about habits, behaviors, routines, I started seeing things differently. I started connecting dots that individually seemed unrelated, but together they painted a very clear picture, a picture of slow, silent, preventable damage. And once I saw that picture clearly, I couldn't unsee it. If that thought has ever crossed your mind, then you're not alone. In fact, you're part of a very large, very quiet group of people who are experiencing the same thing, and who have been told in one way or another that what they're feeling is just part of getting older, that sensitivity is normal, that some bleeding is to be expected, that gum recession happens to everyone eventually. But here's what I want you to understand. Aging is not the enemy. The passage of time is not what's destroying your teeth. What's destroying your teeth is the mismatch between how your mouth has changed and how you're still treating it. And for those who are tired of dealing with bad breath that keeps coming back, gums that bleed without warning, and the constant cycle of expensive dental visits without real answers. Deixamos no primeiro link na descrição guia prático para você acessar de forma rápida, clique e veja. Because once I started connecting scientific research with what I was seeing in real life, everything became clearer. Let me explain what I mean. The mouth evolves with age. This is not opinion, it's biology. The tissues become more sensitive. The balance of bacteria shifts. Hormonal changes, particularly in women after 40, affect gum tissue in ways that are still being studied. The production of saliva, which is your mouth's natural defense system, begins to decrease gradually. And this matters enormously because saliva isn't just about moisture, it's about neutralizing acids. It's about washing away harmful bacteria. It's about remineralizing the enamel surface after every meal. When that defense system weakens, everything downstream becomes more vulnerable. But there's another layer to this that most people don't hear about. After 45, the immune response in the gum tissue changes. The body becomes slightly less efficient at managing low-grade inflammation. And this matters because periodontal disease, the kind that quietly destroys the bone and tissue supporting your teeth, is fundamentally an inflammatory condition. It is not primarily a hygiene problem. It is an immune problem, a chronic inflammation problem, which means that the standard advice, brush more, floss more, while not wrong, is incomplete. Because you can have perfect brushing habits and still develop significant periodontal disease if the inflammatory environment in your body is not addressed. And in our modern lifestyle with chronic stress, disrupted sleep, and processed food, that inflammatory environment is increasingly difficult to control. This is not a reason to feel hopeless. It is a reason to expand your understanding. Because once you understand that oral health after 45 is not just about mechanical cleaning, not just about removing plaque from surfaces, but about managing an entire biological ecosystem that includes your immune system, your microbiome, your hormone levels, your nutritional status, and your stress response, then the conversation changes completely. And suddenly the question is no longer just, am I brushing correctly? The question becomes, am I giving my entire system what it needs to maintain the health of my mouth at this stage of my life? That's a bigger question, but it's the right one. And habits that were once harmless or even helpful can start creating micro damage over time. Take aggressive brushing, for example. Many people believe brushing harder means cleaning better. It's an intuitive assumption. More pressure, more friction, more clean. But after 45, this logic begins to work against you. The gum tissue, which is already thinner and less elastic than it was at 25, starts to pull back under that repeated mechanical pressure. The enamel at the gum line, which is naturally thinner in that area, begins to wear. And over months and years, what started as enthusiastic oral hygiene becomes one of the primary drivers of the very problems it was meant to prevent. I've seen patients brush their gums away. Literally, with perfectly good intentions and a toothbrush that was just slightly too hard, used with slightly too much force, twice a day, every day, for years. They never felt it happening. It was too gradual. And by the time it became visible, the recession was already significant. And the difficult part of that conversation, telling someone that their dedication to brushing contributed to their gum recession, is something I've had to navigate many times because people feel misled. And honestly, they have a right to feel that way. Because no one told them, no one explained that after a certain age, the rules change. Then there's the excessive use of alcohol-based mouthwashes. For decades, the burning sensation of certain mouthwashes was marketed as proof that they were working. The stronger it burned, the more you trusted it, the more you felt like something was happening. But what that burning often signals is disruption of the natural oral microbiome, the delicate ecosystem of bacteria that, in balance, protects your mouth from infection, inflammation, and disease. When you eliminate that ecosystem indiscriminately, not just the harmful bacteria, but the beneficial ones too, you create a vacuum. And nature doesn't like vacuums. What grows back into that space is often more aggressive than what was there before. The harmful strains repopulate faster. The beneficial bacteria, which take longer to reestablish, fall behind. And the net result is an oral environment that is actually more vulnerable than before you rinsed. This is why some people who use mouthwash every day still struggle with bad breath, not despite the mouthwash, sometimes because of it. And when they add more mouthwash in response, they make the cycle worse. They are treating a symptom with something that is worsening the underlying cause. And then there are habits that seem completely unrelated to oral health, like breathing through the mouth while sleeping. Most people don't even know they do it. But mouth breathing at night creates profound dryness, eliminating the protective effects of saliva for hours at a time. Bacteria multiply, acids go unchecked, gum tissue becomes irritated, and you wake up with that thick, unpleasant feeling in your mouth that no amount of toothpaste seems to fully resolve, or diet patterns that affect systemic inflammation, because the mouth doesn't exist in isolation from the rest of the body. High sugar consumption, processed foods, nutritional deficiencies in key vitamins and minerals. These affect the immune response in the gums, the quality of the bone that supports your teeth, the speed at which damaged tissue can repair itself. Your oral health is not a separate system. It is a reflection of everything else happening inside you. Individually, none of these things seem like much. A little extra pressure when brushing, a daily rinse with a strong mouthwash, breathing through your mouth at night, a diet that could be better but isn't terrible. But repeated daily, over years. They create a silent progression, a progression that is hard to see coming, and even harder to reverse once it's already underway. And this is why the fear so many people feel, the fear of losing their teeth, is not irrational. It's often the result of small, consistent mistakes that were never corrected, mistakes that compound quietly, invisibly, over time, until one day a patient sits in your chair and asks, "Why does it feel like my teeth are changing?" And you understand exactly why. I want to take a moment here to acknowledge something important. The fear of tooth loss is not just about aesthetics. It's not just about a smile. For many people, it touches something much deeper. The ability to eat comfortably, to speak clearly, to feel like yourself in social situations. There's a confidence that healthy teeth provide, a quiet background confidence that you don't notice until it starts to erode. I've seen it change people. Not dramatically, not overnight, but gradually. A reluctance to laugh openly, a preference for softer foods, an avoidance of social situations that used to feel effortless, a hesitation before smiling in photos, a habit of covering the mouth with one hand while talking. Small adjustments that individually seem insignificant, but that together represent a slow withdrawal from the fullness of life. And underneath all of that, a slow, accumulating sense of loss that goes far beyond the physical. I remember a patient, late 50s, retired, someone who had built a beautiful life, who told me she had stopped going to dinner with her friends. Not because of money, not because of distance, because she was embarrassed to eat in public, because chewing had become uncomfortable, and she was afraid people would notice, afraid of the questions, afraid of the looks. She said to me, "I used to love food, now I just manage it." That stayed with me. That's the real cost. Not the dental bill, not the procedure. The quiet withdrawal from the things that make life enjoyable. So when I say this matters, I'm not talking about vanity. I'm talking about quality of life, about feeling comfortable in your own body, about being able to eat a meal, have a conversation, share a laugh, without that low-level anxiety humming in the background. That's what's at stake. And that's why understanding this deeply, truly understanding it, is so important. But here's where things begin to change. Because once you recognize these patterns, once you understand that oral health after 45 requires a different approach, you gain something powerful: control. Control is the word I keep coming back to. Because so much of what people experience around oral health after middle age feels out of control. It feels like something that is happening to them, something inevitable, something that their genes decided or their age decided, and there's nothing to be done about it. But that's not what the science says. The science says something different. It says that the trajectory of oral health in this stage of life is significantly shaped by behavior, by daily decisions, by what you do in those 2 minutes each morning and each evening, by what you eat, by how you breathe, by what products you choose and how you use them. Let me give you a concrete example of what this looks like in practice. 2 people, same age, similar genetics. One continues with the same routine they've followed since their 20s. Hard bristled toothbrush, firm pressure, alcohol-based mouthwash twice a day, minimal attention to diet, high stress, sleeping with mouth partially open due to nasal congestion they've never addressed. The other person makes a series of informed adjustments. Softer brush, gentle circular motion, a microbiome-friendly rinse instead of an alcohol-based one. Attention to hydration, because water is the simplest and most underrated support for salivary function. A magnesium supplement that addresses a deficiency affecting sleep quality, which then improves nighttime salivary recovery. A simple nasal strip that keeps the mouth closed during sleep. None of those changes are dramatic. None of them are expensive. None of them require a complete lifestyle overhaul. But over 2 years, 3 years, 5 years, the divergence between those 2 people becomes significant. One continues to decline, the other stabilizes, and in many cases improves. That is the power of aligned habits. That is the difference between reacting to oral health problems and preventing them. You are not a passive observer of your oral health. You are an active participant. And that distinction matters more than almost anything else I could tell you. Instead of reacting to problems, you begin preventing them. Instead of relying only on treatments, you start correcting the root behaviors that lead to those issues in the first place. This is the shift. This is what changes everything. And for those who are already noticing signs, sensitivity, discomfort, that loose feeling, it's not too late. I want to be clear about this. It is not too late. The body has a remarkable capacity for recovery when given the right conditions. The gums, in particular, are highly responsive tissue. With the right approach, real improvement is possible. Not just stabilization, not just slowing the decline, but genuine, measurable improvement. I've seen it happen, repeatedly. In patients who came to me convinced that the damage was permanent, that they were simply unlucky, that their only option was to start planning for the worst. And those patients, when they changed their approach, when they stopped relying on outdated habits and started aligning their routine with what their body actually needed, experienced changes that surprised them, that moved them, that gave them back something they thought they had already lost. There is a path forward. There is a method designed specifically for this stage of life, focused on protecting and strengthening what you still have. Se você quer entender melhor esse caminho e começar de forma segura e eficaz, deixamos no primeiro link na descrição guia prático para você acessar de forma rápida, clique e veja. What I've learned after years in this field is simple, but rarely explained this way. Your teeth don't suddenly become weak. Your gums don't randomly start failing. There is always a process behind it. A slow process. A quiet process. One that happens in the background of daily life, hidden behind routines that feel correct, behind products that promise results, behind habits so ingrained they've become invisible. But invisible doesn't mean harmless. And that's what I want you to carry with you from this conversation. Not fear, not urgency, but awareness. The kind of awareness that changes how you look at your daily routine, that makes you ask, maybe for the first time, is what I'm doing actually aligned with where I am in life right now? Because the truth is, most people are still following the oral health playbook they learned at age 12. And for most of their lives, that was fine. The body compensated. The margin for error was wide. But after 45, that margin narrows. The body needs more intentional support. And the playbook needs to be updated. The good news is, there is also a way to interrupt that process. Science already points to strategies that help preserve gum integrity, support enamel strength, and maintain a balanced oral environment, even after 45. Strategies that go beyond brushing and flossing. Strategies that address the microbiome, the inflammatory response, the mechanical forces applied to the tissue, the nutritional environment that either supports or undermines your body's ability to repair itself. These strategies are not complicated. They are not expensive. They do not require dramatic lifestyle changes or hours of additional effort each day. What they require is understanding and adjustment, small, precise adjustments that align your daily habits with your current biology. But these strategies only work when they are applied with awareness, when daily habits are adjusted to match what your body actually needs now. That's the shift most people never make, not because they don't care, not because they aren't motivated, but because no one ever explained it to them this way. No one ever connected the dots between the science of aging oral tissue and the practical decisions of daily life, until now. Because that's exactly what I'm committed to doing in this space. Breaking down the research, making it real, making it applicable, giving you not just information, but understanding deep enough to actually change how you act. But once they do, everything changes. Confidence starts to return. The discomfort fades. The constant worry begins to disappear. Those small moments of anxiety, the ones that happen every time you bite into something hard, or notice a little blood on your toothbrush, or feel that slight shift in how your teeth come together, those moments start to become less frequent, less intense, until one day you realize they've stopped entirely. And something even more important happens. You stop feeling like you're racing against time, and start feeling like you're finally in control of your own health. That feeling is not just psychological, it's grounded in real physical change, in tissue that is healthier, in an oral environment that is more balanced, in habits that are now working for you instead of quietly working against you. I want that for every person watching this, not because oral health is the most important thing in the world, but because it affects so many other things, the way you eat, the way you speak, the way you feel about yourself when you walk into a room, the freedom to laugh without thinking about it first. These things matter, and they are within reach. But reaching them requires a different kind of conversation than most people have had about their oral health. It requires honesty about what's actually happening inside the mouth as we age. It requires willingness to question habits that have felt correct for decades, and it requires access to information that is grounded in science, communicated clearly, and designed to be actually useful in real life. That's what this channel is about. And if this message made you see your routine differently, if something I said today landed in a way that surprised you or confirmed a suspicion you've been carrying for a while, then make sure you stay with me. Because this is just the beginning of a much deeper understanding that can completely transform the way you care for your health moving forward. There is more to cover, much more. The specific habits that accelerate gum recession after 45, the nutritional deficiencies that most adults don't know they have, and how they directly affect the strength of your teeth, the connection between sleep quality and oral health that almost no one talks about, the role of stress hormones in creating the conditions for periodontal disease, the simple adjustments that can make your existing routine dramatically more effective without adding time or cost. I also want to talk about the things dentists often don't have time to explain in a 20-minute appointment, the relationship between gut health and oral health, the specific minerals that your enamel needs to remineralize, and the dietary patterns that prevent absorption of those minerals even when you're consuming them, the science behind why stress quite literally changes the bacterial composition of your mouth, why certain medications that millions of people take daily create oral side effects that are rarely discussed. These aren't obscure topics. They are directly relevant to the lives of most people watching this, and yet they rarely come up in a routine dental visit because there simply isn't time and because the clinical model isn't designed for that kind of education. That's the gap I want to fill. All of that is coming. Because the goal is not to give you a single video's worth of information and send you on your way. The goal is to build together a complete and accurate picture of what oral health actually looks like at this stage of life and what it takes to protect it. Not a picture built on fear, not a picture built on selling you something, a picture built on science, on clinical experience, and on genuine respect for your ability to understand your own health and make informed decisions about it, because that's what I believe you deserve. Not oversimplified advice, not vague warnings, real information explained clearly, applied practically. Information that you can take home and use tomorrow morning when you pick up your toothbrush. Subscribe to the channel because in the next videos I'm going to show you exactly how to protect what still remains and how to rebuild your confidence step by step. This isn't about fear. It's about finally having the right information at the right time so you can make the right choices. And that starts now, because every day that passes with the wrong habits is a day of preventable damage. And every day that passes with the right ones is a day of real, measurable protection. The difference between those two paths is not money. It's not access. It's not luck. It's understanding. And you're already here, which means you're already closer than you think.